So today we discuss about the two scenario in functions of kidney, particularly nephron. So in earlier videos we discussed about the role of the vasopressin, the way vasopressin is secreted and binds with the receptors of the distal part of the tubules, and ultimately the fusions of aquaporin channel in the luminal part of the tubular cell, and that results in reabsorptions of H2O from filtrate into the interstitial fluid and ultimately entered into the peritubular capillary. So first condition, that is H2O deficit condition. In H2O deficit condition, our body wants to save the water. Our body wants to conserve the water. So in this scenario, vasopressins play very important role in the distal part of the tubule. So the fluid comes from proximal tubule, enter into the descending part of the loop of Henle. The concentrations of the fluid is 300 milliosmol per liter, and this 300 milliosmol per liter concentrated urine enter into the loop of Henle. The descending part of the loop of Henle is permeable to H2O. So H2O moves from the filtrate towards the interstitial fluid. As we move downward from cortex into the deeper portions of the medulla, the osmolarity of the interstitial fluid increases up to 1200 milliosmol per liter. So the fluid that reaches deep of the medulla reaches the osmolarity about at 1200 milliosmol per liter. So this is the maximum concentrations of the fluid. Now the ascending limb, this is the ascending part of the tubule. This ascending part of the loop of Henle is impermeable to H2O, but NaCl is pumped out from the filtrate into the interstitial fluid in this part. As the NaCl pumps out from the filtrate, the concentrations of the filtrate decreases and reaches up to 100 milliosmol per liter. And these 100 milliosmol per liter concentrated, or you can say less concentrated fluid enters into the distal part of the tubule. In H2O deficit condition, vasopressin binds with the receptor and the water channels fused with the distal part of the tubule, that is collecting duct and distal tubule. So water moves from the filtrate into the interstitial fluid and ultimately enter into the peritubular capillaries. So this movement occurs in H2O deficit condition, and the concentrations of the fluid gradually increases and reaches up to 1200 osmol per liter. So concentrations of the urine may be up to 1200 milliosmol per liter as it leaves the collecting tubule in case of H2O deficit condition, because our body conserves H2O and these H2O enter into the peritubular capillaries and ultimately our body save the water. from the excretions of excess H2O. Now, but on the other case, there is another scenario, that is H2O excess condition. So in case of H2O excess condition, our the vasopressin does not work because our body already have excess H2O, and the filtrate the H2O which is came from the filtrate does not need for our body. So the fluid that comes from the proximal tubules enter into the loop of descending part of the loop of Henle. The descending part of the loop of Henle permeable to H2O. So H2O moves from filtrate into the interstitial fluid and reaches up to 1200 milliosmol per liter. So as we move towards deepers of the medulla, the concentrations or osmolarity of the medullary interstitial fluid increases up to 1200 milliosmol per liter. This 1200 milliosmol fluid enter into the ascending part of the loop of Henle. Ascending part of the loop of Henle is impermeable to H2O, as we discussed earlier. But NaCls pumps out with the help of ATP into the interstitial fluid. So movement of NaCl from filtrate into the interstitial fluid leads to diluted the fluid which is present in the tubular part and reaches up to 100 milliosmol. This 100 milliosmol enter into the distal tubule, but in this case H2O excess condition, vasopressin is absent. So there is no water channels present in distal tubule and collecting duct. So absence of water channel leads to excretions of diluted urine, because although the concentration of the fluid is less than the concentrations of the fluid which is present, the concentrations of the interstitial fluid. As you can see, the osmolarity of the medullary interstitial fluids remain same as in the case of H2O deficient condition. But in this case, there is no movement of H2O, although the concentrations of the fluid inside the tubule is less than the interstitial fluid, because there is no water channel present in the distal part of the tubule. So the less concentrated urine ultimately excreted out from our body. So large volume, in case of H2O excess condition, large volume of dilute urine, as you can see 100. So the concentrations of urine may be as low as 100 milliosmol per liter as it leaves collecting duct. So excess H2O eliminated. So the volume of the urine is larger than the volume of, in the case of H2O deficit condition, and this is dilute urine. But on the other hand, in the case of H2O deficit condition, the small volume of concentrated urine is formed, and due to reabsorptions of the H2O from the distal part of the tubule. So this is the two scenario. You can easily differentiate the two scenario. The vasopressins play a very important role in conservation of the H2O in our body. If you like the video, please share it with your friends. Thank you.